Hello, Dr. Vidya, TS, Consultant Dermatologist, Sagar Hospitals. Today I am going to talk to you about hair fall, crowning glory. Who is not interested in having good hair? Everybody. So here when I am talking about hair fall, very rarely we see hair fall in children. So we do not have strong medicines for children at all. Unless the child has undergone some fever, typhoid or maybe some surgery or any other serious illness, children will not have hair fall. Now let's go to the adult life. So hair fall, there are a lot of causes why we have hair fall. We have generalized hair fall where we call it as telogen effluent, which can happen post, as I said, typhoid. Maybe now the commonest cause is COVID. Post COVID we see a lot of people having hair fall. That is because of the stress levels. This happens when there is acute stress, post any surgery, there's a death in the family or maybe something which has shocked you. So these things can give rise to telogen effluent. So when we say telogen effluent, usually after the event occurs, 2 months later you can have hair fall. Maybe 2 months, 3 months is what we say. When you take a history, you ask them if any of these events has happened 2 months ago and they'll definitely give you a history. Sometimes this telogen effluent can go for a longer time where we call it as a chronic telogen effluent. It can go on about 2 years. So you really don't know what is triggering the hair fall in these patients because they could be completely stressed always. So next comes the alopecia. We say alopecia areata. Alopecia areata is the sudden hair fall in small patches. Alopecia areata has become very famous now. So you have patches, it's not just on the scalp. You can have a hair fall, one patch of hair just disappearing from your eyebrows, from your beard, from your moustache or maybe anywhere in the body. That is called as alopecia areata. Usually there are no symptoms in alopecia areata. Sometimes there is a little itching which could be because of a fungal infection. So you treat the fungal infection, the hair grows back. When we say alopecia areata, it could be an autoimmune condition where there is no reason or sometimes may be associated with an underlying cause like hypothyroidism or diabetes or something like that, something stress induced. So when there is alopecia areata, sometimes overnight you see patches. In 2-3 days you get multiple patches. There is no symptoms at all. You just notice a hair patch. Sometimes when you go to the barber or for your hair cutting salon, then they notice the patch. Otherwise you will not even have any symptoms. These kind of alopecia areata patches, the hair grows back on its own. Maybe it takes about a month. If it doesn't grow, sometimes it doesn't grow at all. So that is why you have to come to the doctor and take treatment. Sometimes the hair grows grey, but it turns to black later. So we have topical creams. Sometimes we have immunomodulators which we give you systemically. If it still doesn't work, we give you intralesional steroids over there and the hair grows back. Suppose it is an ongoing process, you are getting multiple patches, then we have different ways of treating alopecia areata. So now other than telogen effluent, alopecia areata, we have the generalized hair fall, what we call it as patterned hair fall, female pattern hair loss and male pattern hair loss. We call it as patterned hair loss because you've seen bald people, there is a particular pattern in which this hair fall happens. In women, women also can get bald, but the frontal line is always retained in women. They will not go bald completely like men. So that maybe we are a little luckier than the men. So when it happens in patterns, initially in men there is a little receding in front and then they get a patch at the back and then the whole thing joins and becomes one big pattern. So here we have grades. We have classifications different from women, different from men. So there is a grading in this. If you come to the doctor in maybe grade 1, grade 2, it's very easy for us to treat you because your hair would have just started becoming miniaturization, we say. They start becoming like baby hair is when we can treat and make the hair thicker and all the hair follicles which are not dead can become active. If you come between 2 and 3, still manageable, but if you come when your hair fall is almost grade 4, it becomes very difficult. We cannot grow the hair. Hair transplantation is the last option. A lot of people think if you go to doctor for baldness, they advise you hair transplantation. That is the last option. We do treat you medical line. There are a lot of medicines available. We have to rule out sort of nutritional deficiencies also. Now post COVID, because 2 years a lot of people are indoors, we have to rule out vitamin D deficiency, vitamin B12 deficiency in vegetarians, biotin deficiency or maybe some other underlying cause, thyroid, all the other autoimmune conditions too. When you take a history, we say this baldness usually comes from the maternal side. It's more common that if your mother's brothers are bald, then your chances of getting bald is a little more. If not, it is your father. If not, then your individual hormones. So these investigations are done and then we start the treatment. So minoxidil is the treatment which is US FDA approved and we start. We start in different strength. For women we start 2%, for men it is 5%. Off label we do start 5% for women also. Only thing, when we are giving minoxidils for patterned hair fall, it has to be lifelong. You have to keep applying minoxidils twice every day, whatever strength and whatever dosage your doctor has told you. Hair starts growing after 2 months. You should have patience. Hair will not start growing in a week or 10 days. After 2 months, the hair will start growing. You can see the changes. The volume of your hair increases. Individual hair weight, what miniaturization has happened, becomes thicker, and the hair grows in length also. Once you stop, it comes back to original level. So you will have to keep applying. If you are not responding to the topical minoxidil, then we have other options like PRP or maybe hair transplantation or other things. So please consult your doctor when it is early only, maybe stage 1, grade 1, grade 2, whether it is a man or a woman. Even for alopecia areata and telogen effluent, because telogen effluent you start getting scared that you might become bald. So please consult your doctor. Thank you.